Between the champagne, the countdown, and the fireworks, New Year's Eve can be a lot of fun, except for many of those with four legs, fur, and a tail.
With party guests leaving doors open, handbags unattended, and cocktails in easy reach, many accidents can happen to your pets.
That's right, and if that unfortunate moment does happen, you want to be ready to treat your pets with the best care.
So we headed out to ABQ Petcare with Dr. Victoria Bingham to find out more about when your pet needs surgery after an accident and what you should know. Take a look.
Here at ABQ Petcare, we really advise to take the right precautions before putting your pet under anesthesia. Anesthesia can definitely be a very nerve-wracking and sometimes scary thing for pet owners. So at ABQ Petcare, we really want to inform and educate our clients about what is anesthesia and what things you need to look for anesthesia for your pet. We really want to do things beforehand, during and after anesthesia. Beforehand, we recommend that all pets get blood work. The reason for that is because the blood work will indicate how is the pet's organs functioning. Do we need to make any alterations to our medications? Also, if there is something, maybe we cannot perform anesthesia on that patient. Another thing that we'd like to do before anesthesia is x-rays. If your pet is having a heart murmur or if there's any other form of cardiovascular disease going on, we may want to do an EKG or a chest x-ray or some other kind of x-ray. So it's very important we do some pre-anesthetic diagnostics. During anesthesia, it's very important that patients are intubated, and what that means is placing a tube in their throat as a breathing tube that supplies oxygen to the pet. That way we can monitor them and also control their breathing. The other thing is you want to make sure that your pet is hooked up to an EKG. We have all of our pets here at ABQ Petcare hooked up to an EKG, blood pressure monitoring. We also have a Doppler blood pressure, and then also we have something to monitor their respiratory rate, their carbon dioxide intake and output. We also are monitoring their vitals, their heart rate, their temperature, and just overall their overall care. So we'll provide them warmth and whatnot. In addition to that, we also give them IV fluids. What that IV fluids are going to do is supply them with hydration and also maintain their blood pressure. We want to make sure their kidneys are getting good hydration. We see a lot of pets that it's potential if they don't get IV fluids during anesthesia, that can result in kidney failure after anesthesia. After anesthesia, it's very important that we take the right steps to make sure that the pet is waking up and is bright, alert, and aware, and also warm. So afterwards, we take out their breathing tube. Our technicians are with them the entire time. So overall, when deciding if anesthesia is a good thing for your pet, I highly recommend you ask questions about what is it that your veterinarian does before anesthesia, during anesthesia, and after anesthesia, in order to make sure that your pet has a good, successful anesthetic procedure. We're at 9032 Montgomery Boulevard, Suite C, and we're at 299 Vets, that's 299-8387, or you can find us on Facebook.